Oral rehabilitation is restoring the teeth back to their original condition. Sometimes that's through utilizing the natural teeth that patients have, or sometimes it's using prosthetics to replace missing teeth or broken down teeth. Anything from crowns to dental implants. It really allows us to restore patients back to their functional goals, to be able to chew and eat the foods that they like without experiencing pain. Patients who have gone without teeth for quite some time can have a sunken in appearance regarding their teeth and their jaws and their cheeks. And that can have a negative impact on their smile. Through the use of crowns and dental implants, we're able to restore a patient's function. We're able to give them the ability to chew, the ability to bite without pain or without problems, and really just go back to experiencing life the way it should be, without a care. Patients who do need oral rehabilitation go through a kind of a systematic process. We gather diagnostic information, we architect a plan for them, and then we implement that plan and give them back their function and the ability to chew and bite without pain.